Hey there, and welcome to this explainer. If you're tuning in today, well, chances are you're searching for some answers. The fertility journey, it's incredibly personal, right? Sometimes it literally feels like navigating a massive maze without a map, especially when all that intense medical jargon gets thrown at you. But today, we're going to change that. I'm going to walk you through a highly insightful tool called chromosomal karyotyping. Together, we'll break down exactly what this is, why your care team might recommend it, and what it actually means for your path forward. My goal is for you to leave this explainer feeling informed, reassured, and absolutely empowered. Okay, let's dive right in. Looking for answers on a fertility journey carries such a heavy emotional weight. When you're facing those really heartbreaking hurdles, like repeated miscarriages or implantation failures, the absolute hardest part is usually just asking, why? Why is this happening? And when we don't have answers, man, it is so easy to blame ourselves. But the truth is, fertility is immensely complex, and sometimes the answers are hidden away at a microscopic level, completely out of our control. So we're going to look for those hidden answers together. We're stepping away from the unknown and stepping right into clarity. Section 1. What is chromosomal karyotyping? Now, I know the term chromosomal karyotyping sounds super intimidating, like something out of an advanced biology class. But honestly, the concept is surprisingly simple. A karyotype is just an evaluation of a person's chromosomes. Think of your chromosomes as the bookshelves in your body's library, holding all the genetic instruction manuals that make you, well, you. This test is basically like shining a flashlight onto those bookshelves. It specifically checks three things: the structure of those shelves, the total number of them, and how they're arranged. By doing this, doctors are simply looking for any tiny structural changes or numerical differences that might be quietly affecting your reproductive health. So what exactly are we looking for when we shine that flashlight? Well, the magic number here is 46. A normal, healthy karyotype contains exactly 46 chromosomes, and these are beautifully organized into 23 pairs. This includes your sex chromosomes, which are XX for females and XY for males. This 46 chromosome baseline is the standard blueprint. When your doctor orders a karyotype, they're simply verifying that your personal blueprint matches this standard arrangement. They just want to ensure that the foundational genetic instructions for creating a healthy pregnancy are all present and filed away exactly where they should be. Section 2. Why consider this test? If your doctor has brought up karyotyping, I really want to reassure you. This is a proactive step. It's moving away from guesswork. Doctors usually recommend it in a few specific situations. Most often, it's when a couple has experienced repeated miscarriages or implantation failures during treatments like IVF. It's also used if an individual shows congenital anomalies associated with a genetic disorder, or if a developing fetus is suspected of having a chromosomal abnormality. And I want to pause here for a second because honestly, seeing these terms can be really tough. If you've experienced these losses, I know it is devastating. But medically speaking, discovering a numerical change or a structural rearrangement through this test can be a massive breakthrough. It can finally provide a concrete explanation for those difficult hurdles. It takes the mystery away, and replaces it with actionable medical knowledge. Now, you might be wondering, okay, how intrusive is this genetic detective work going to be? The great news is that it's highly accessible. The test can be performed on almost any tissue. For adults looking for answers regarding their own fertility, it's most commonly and easily done through a simple standard blood draw. If the test is checking on a pregnancy, doctors might use amniotic fluid or chorionic villus samples. But for the vast majority of fertility patients sitting in a clinic, finding out this profound genetic information requires nothing more than rolling up your sleeve for a routine blood test. It really is that straightforward. Section 3. How the test works. To really understand this, let's pull back the curtain and take a tiny journey right into the cell itself. Normally, in their non-dividing stage, your chromosomes exist as these long, super thin threads. Imagine a massive, tangled pile of fine yarn. It would be literally impossible for a scientist to count or examine them in that messy state. But nature is incredibly clever. When a cell is about to divide, those fine threads wind themselves up into tight, compact packages. Suddenly, that messy pile of yarn is neatly spooled. And it is only during the specific dividing stage that the chromosomes become visible and studyable under a microscope. Knowing how that works makes the laboratory steps completely logical. Step 1, the laboratory scientists take your cells and culture them, basically encouraging them to grow and, crucially, to divide. Step 2, right when those cells hit that perfect dividing stage where the chromosomes are tightly wound up, the scientists gently arrest or pause the process. Step 3, they apply a special dye to stain the chromosomes, which gives them these distinct banding patterns. And finally, step 4, They photograph them through a high-powered microscope. It's this very delicate, precisely timed process designed to capture your genetics at the exact perfect moment. Once that photograph is snapped, your sample moves right into expert hands. It doesn't just get a quick glance. A highly trained clinical scientist carefully analyzes the image. And they aren't just using their eyes. They're utilizing specialized computer software specifically designed to map out, arrange, and evaluate every single one of those stained chromosome packages. They pair them up, 1 through 22, plus those sex chromosomes, and look so closely at the structure of each one. You can absolutely rest assured that your sample is being treated with the utmost precision and cutting-edge technology. Section 4. Understanding your results. We all know waiting for the phone to ring is often the absolute hardest part of any medical test. Typically, it takes about 14 to 28 days for karyotype results to come back. Yep, 2 to 4 weeks. If you're an anxious patient waiting for answers, I know that can feel like an eternity. But remember those laboratory steps we just looked at? The scientists actually have to culture your cells and wait for them to physically grow and divide before they can even photograph them. That biological process just takes time. Setting this clear, manageable expectation right now helps you prepare for the wait. Your cells are just taking the necessary time to reveal their secrets. So, what actually happens when those results come back? Like we talked about earlier, the standard baseline is 46XX for a female and 46XY for a male. If your test shows any deviations from that 46, whether it's a missing piece, an extra piece, or a rearranged piece, it is noted as abnormal. Now, I want to pause on that word. Abnormal sounds scary, right? But in the context of a fertility journey, I really want you to reframe it. These deviations are exactly the kind of valuable, personalized clues this test is designed to find in the first place. Finding an abnormality isn't a failure. It's the discovery of the puzzle piece that has been missing all along. And here is the most important thing to remember. You are never, ever left to decipher these clues all by yourself. As the source material directly states, the clinical relevance will be communicated by the requesting physician or genetic counselor. If there is a structural rearrangement or a numerical change, an expert is going to sit down with you. They're going to gently explain exactly what that specific result means for your overall health, what it means for your fertility, and most importantly, how it shapes your specific treatment plan moving forward. You have a dedicated team ready to guide you through the what's next. Which brings us to the main thought I want to leave you with today. Knowledge about your genetics, it isn't something to fear. Really, it's the very first step toward a personalized path forward. A chromosomal karyotype might feel like a big, intimidating test, but at its core, it's just a way of honoring your body's unique blueprint. By shining a light on your chromosomes, you and your medical team are taking power back from the unknown. You are paving a clearer, safer, and much more informed roadmap toward building your family. But as science continues to evolve at this incredible pace, it does make you wonder, what other microscopic clues are we on the verge of discovering to make the fertility journey even easier for tomorrow's families? Keep asking those questions, keep advocating for yourself, and I'll see you in the next explainer.